Welcome back to Public Affairs on Peach. We are focusing on the Zika virus this week, and in this segment, we talk about the Zika vaccine. Dr. Cherie Edipugante is Associate Professor of Medicine at Emory School of Medicine, and she joins us now. Now, you are leading the National Institutes of Health clinical trial at Emory, and we know that Emory is one of 3 sites in the country that is conducting these trials. Tell me about that.
So Emory is conducting a Zika vaccine trial. The vaccine's been developed by the researchers at the Vaccine Research Center at the National Institutes of Health. Emory and the University of Maryland and the NIH itself are the 3 clinical research centers that are conducting this trial. So the trial involves testing a Zika vaccine in healthy people. The vaccine trial, typically a vaccine trial is done is when people will be asked to receive 1 to 2 shots of vaccine, or 3 depending on the group that they're assigned to, followed by serial blood draws so that we can measure the immune response to the vaccine.
Okay, and how does this vaccine work? You're really trying to use Zika against itself?
So in this particular vaccine is encoding, it has the genetic code for the body to create 2 proteins that are part of Zika virus. So then the body will make an immune response to the proteins, and what we're particularly looking for is antibodies to the proteins.
Okay, are you still looking for volunteers at this point?
Yes, we're actually just beginning and starting to screen for this study. Yes, absolutely.
Okay, and any timeline on when you expect your first results, when the vaccine might be ready?
So across the 3 centers, we believe that we can finish the trial by the end of this year, and we should have early results in early 2017.
Are you optimistic that this vaccine can be developed and then spread, throughout the world? Because really, it's a worldwide epidemic at this point.
So this is the first vaccine that is moving on into human trials. Actually, there's one more that's also just started. The data in animals are very encouraging for this vaccine and others that are undergoing trials. So I am optimistic about this vaccine, but the only way to answer that question is to do the clinical trial and then arrive at that conclusion.
Is there any timeline on how long that may take before we might actually see it on the market, or you and me can get injected with this Zika vaccine?
Obviously, we're trying to accelerate the research given the pressing need for a Zika vaccine. So we hope that there'll be this particular vaccine, if it turns out to be very immunogenic, potentially in 2018.
Now, we talked earlier about some of the things that people can do to protect themselves from Zika right now while a vaccine is not available. One of the biggest risks is really traveling outside of the country. If you're here in the United States, the risk isn't really that high, but once you travel outside to some of these countries that have a higher prevalence of the Zika virus, that's when you're probably going to be the most exposed.
That's correct, yes.
So what would your recommendation be for people that are traveling, especially pregnant women?
Oh, with respect to the vaccine or just in general?
In general.
Pregnant women who are traveling.
Because there is no vaccine for them or for anyone at this point, right?
That's right. So taking precautions against Zika is obviously the most important thing, and that is minimizing exposure to mosquitoes and preventing mosquito bites, and that's typically done by staying in homes or dwellings that have air conditioning or have netting on the windows, as well as using mosquito repellents, are the 3 mainstays that I can think of when you're traveling.
All right, we're going to keep reiterating that. Thank you so much for joining us today.
Sure.
And stay with us when Public Affairs on Peach returns, how one metro county is fighting mosquitoes and what you can do to reduce the chance of being bitten.